It's been 15 years of outstanding leadership in the national response to HIV. 15 years of challenges, but also notable milestones towards a more controlled epidemic. Yes, the National Agency for the Control of AIDS, Naca, recently celebrated its 15th year in existence. Hello and welcome to this episode of The Last Mile with Naca. I am Adesuwa Osui. There is a lot to celebrate in Nigeria's response to HIV and AIDS, such as the significant reduction in morbidity and mortality rates due to more persons living with HIV being placed on life-saving medications. But it was also a day to reflect on the journey thus far, review the status of the response, and plan for the future. This episode brings you highlights of the Naca Stewardship Day. Don't go away.
The 22nd of February 2022 marked the 15th anniversary of the National Agency for the Control of AIDS, Naca. This day, dubbed the National HIV Response Stewardship Day, now celebrated annually since 2021, provides an opportunity to reflect on the journey thus far, share the vision to end the epidemic by 2030, and celebrate all communities, partners, and stakeholders for achieved milestones. The second edition of Naca Stewardship Day had in attendance many dignitaries, including the Secretary to the Government of the Federation, Minister of Health, Chargé d'Affaires, U.S. Embassy in Nigeria, representatives of sister agencies, implementing partners, and civil society organizations. Delivering the opening remarks, the Director General of Naca, Dr. Gambo Aliyu, expressed delight, stating that Nigeria is on the verge of achieving epidemic control.
I'm happy to say that after 2 decades of sustained fight against HIV and AIDS, Nigeria is on the verge of achieving unique programmatic indicators for epidemic control due to tremendous growth in our programs over the last 6 years. This year, we expect a tremendous growth in our program for prevention of mother-to-child transmission of HIV as we take key steps towards ensuring no child is born HIV positive in Nigeria. Our innovative strategies in program alignment by all stakeholders, service integration at all community levels, and strong political support at all levels made our national response the most COVID-19 resilient in the world, with the highest yield at the peak of COVID-19 pandemic. As we approach epidemic control, we need to end all forms of inequality, leave no one behind, as well as ensure inclusive implementation of our programs at community levels if we must sustain the gains made in the last 6 years.
The first set of goodwill messages were delivered by the Global Fund Portfolio Manager, Dr. Jean Thomas, and Mary Lorraine Melchizedek, representing the Controller General of the Nigerian Correctional Services.
The CGC wishes to thank Naca for their efforts towards the coordination of various organizations, international bodies, and agencies involved in the HIV/AIDS program in the Nigerian Correctional Service. Naca has been there for us from inception till date. Your contributions have immensely impacted on the Correctional Service HIV/AIDS program and activities. We have over the years enjoyed your relentless efforts in several measures, including the recognition and positioning us as a key population and vulnerable group. We say a big thank you for this to Naca. Training and retraining of our personnel on HIV/AIDS and other related activities, making it possible for the service to be able to manage people living with HIV in our environment, ensuring that always we are not left behind in all areas of HIV/AIDS activities.
The Global Fund collaboration with Nigeria started even before Naca was born, 20 years ago. Since the beginning, the Global Fund has made Nigeria its major partners. So all this mobilization of resources is thanks to the good work that is done by Naca and also by all our partners here present. And I want to state here that the Global Fund will continue to play its role to mobilize more resources and to encourage not only Naca but the Nigeria population to access more HIV interventions, and we will walk through with Naca to see Naca progressing to its adulthood.
Citing effective partnership as critical in the HIV response, the Chargé d'Affaires, U.S. Embassy in Nigeria, Kathleen Fitzgibbon, pledged the U.S. government's support to Nigeria.
I just think we should all say happy birthday, Naca. It's been a wonderful 15 years, and we have a lot to be happy about today. With Naca, all of the SACAs, the state governors and health commissioners, NASCAP, UNAIDS, the Global Fund, Ashwan, NEFWAN, our implementing partners, and now the HIV Trust Fund, and all of these allies in the fight against HIV. And as you can see, we're actually winning. And that's something that required partnership. Anybody couldn't have done this alone. So the theme of my discussion is kind of togetherness. Togetherness means that in one national program, with effective contribution from the government, donors, and partners, these are our objectives. One national HIV treatment program with the government in the lead, expanding its leadership and financing. Data access, platforms to be used by everybody involved in the alignments. Key population programming that's unified under a national investment framework. Each partner's comparative advantage is maximized. An alignment agreement with services and support, which ones will be increased, decreased, and or discontinued. So together we've hit the ground running and driving.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
Highlight of the occasion was a presentation by the Director General, Naca, on the landmark achievements in Nigeria's HIV and AIDS response from 2015 to 2021.
These few slides summarize what we were able to achieve in the last 6 years, exactly from 2015 to 2021. Why we chose this period of time between 2015 to 2021, because it is actually from 2015 and right after 2015 when these innovative strategies that we have rolled out and have worked very well started. So, but we are not saying before 2015 no work was done. No, a lot of effort it was in place, and we were out in the community actively searching for cases. But later we learned to use information and to use data to grow our program. And if you look at it, way back in 2015, we had only about 617,000 individuals on treatment. And from that time to now, that we have everything we needed to track the numbers, to have the numbers counted, we now have 1.7 or 1.8 million on treatment. So up by about 1.1 million from that period. The HIV Program Development Project of the World Bank, did something that was unique. And we saturated the communities with HIV prevention program in about 32 states in Nigeria. And I'm coming back to this because, at this material time, we are saturating the same communities, but this time using information with treatment program. So you can see how these two added, over this period of time. And it was the same year that the government started to test the waters in terms of having to manage the program or implement the program at state level, in such a model that may be economically viable, going forward, because we know the amount of money we have and the amount of support we have, we need to look inward to see how can we make savings and how can we do with less. The National Data Repository we have is helping us do a lot of things. It is helping us to monitor and evaluate. It is helping us to monitor also our progress towards controlling the epidemic. Unlike before, we cannot do that. We have to call the individual state. We have to validate data from individual state. We have to come in and collect, using pen and pencil, using paper and pencil, and with a lot of risk for errors and the rest of it. This is the turning point, actually, in the whole fight against HIV in Nigeria. So we were able to find out that actually about 2 million people are living with HIV in Nigeria. And the nice thing about it, it helps us with geographical locations, where most of these people are staying. So it did not only give us the estimate, but it helped us track the communities where we know the shoes are pinching the most, with what we call ART surge. So we saturate the community, we look for people, at community level, provide them HIV services, identify cases, and make sure we immediately link them to treatment, and we return them on treatment. What that does is we now go after the virus, find where the virus is located, and fix the virus there to make sure that the virus doesn't come out. So other landmark achievements that we have made over this period include the HIV self-testing from the comfort of the room. People can now test and know about their HIV status and do something. And we know that HIV is not only about health. HIV is about security. HIV is about poverty. HIV is a developmental disease. And we're doing our bit, reaching out to the community. And this is over these 2 years, largely with the help from UNAIDS basket funds for COVID. We were able to empower about 10,000. And from our meager resources in Naca, we were able to empower about 2,000 people who are vulnerable all over the country. This is one area to invest, especially among the poor and vulnerable individuals. Empowering them will at least provide them opportunity to come to our clinics to take medication, to travel. Sometimes that transportation money, 200, 300, is very difficult to some of these people. And as we did for NICE look at the general population. The integrated biobehavioral survey focus more on the population actually that matters most when you come to controlling HIV. And this is the key affected population. This also gives us an idea about their spread in the country, location, and how HIV is distributed among them, and the services actually they prefer and where they prefer to take these services. This is just to show you the effort that has been made in the last couple of years and the results. The red line you're seeing is the projected number of people living with HIV/AIDS in the country at this particular period, and you can see how we've been closing the gap. And come 2021, you can see how we are rapidly approaching the total number. So as soon as we approach that total number, we are coming back here to celebrate again. We're not there yet, yeah, but we are working hard to close that gap, to make that red line and green line to come together. And you can see how it took us from 2015. You can see how wide apart these lines are. And now come to 2021, you can see how we are closing the gap. And we are presenting here the modest projection, modest estimates. So this is what I was talking about. There is no way you can end AIDS. There is no way you can get to control HIV without finding ways to access key affected population and take services to them. In 2015, we virtually have none in terms of those sites that are preferred by key affected population where they take the services. But with time, you can see our growth, especially 2021. We have grown from 0 to almost 120 sites all over the country where key affected population now feel comfortable, secured to go and access these services. Not only access these services, but to make sure we fix the viruses in them. So this is what alignment has achieved. Without alignment, this was what we were able to achieve between 2019 and 2020. But you can see how the number jumped in terms of what we were able to identify, add to treatment between 2020 and 2021 after the alignment. So really there is value in coming together, to put all our tools together and see, what the government can do very well, what Global Fund can do very well, and what PEPFAR is good at. And then now I say, you do this and we do this, and we make sure there is no duplication, and we count the numbers. And this is what we are seeing. And this is what other countries are learning from Nigeria. With what we have achieved over the last 6 years, with the innovations that we brought to bear in terms of, coordinating the national response, and where we find ourselves, it is now very, very important to see how we harness all this achievement, especially what we've achieved with alignment, especially what we've started with states, bringing states on board and making sure the states, take the rightful positions, streamlining all this and creating a sustainability model. A model that can help us sustain these numbers that we have on treatment, even when the big money that we have begin to go down, and it has already started going down. But at the same time, we're still keeping to our promise. So this is what we will continue doing. But we have already started talking with our stakeholders to see how we come up with a sustainability model, that will continue to absorb these shocks as time passes by.
There were also goodwill messages from the Naca board chairman, Senator Oladipo Dujiri, and the Minister of Health, Dr. Osagie Ehanire.
It has been 15 years since Naca was formally established as an agency and given the mandate to coordinate the multi-sectoral HIV response. The response has evolved significantly since then. And starting with the early days when there was a lot of focus on establishing the systems and structures for the response, which we now leverage for both coordination efforts and service delivery. The last 5 years in particular have been marked by significant advancements for the HIV response. I note the important contribution that robust coordination has made to some of these accomplishments. I congratulate the Director General, Naca, management, and staff of Naca, not forgetting the chairman of the board, and commemorate on the commemoration of this Naca Day. There is no doubt that leadership and collaboration are important. Therefore, I look forward to joining forces with you, as always, to strengthen the program overall for the benefit of our country.
We've all had the DG present a beautiful picture of how we're becoming and the way forward. Today, we celebrate the 15th anniversary of the agency and seize the opportunity to recommit ourselves to the great task of putting an end to the AIDS scourge by 2030, by remaining dogged and resolute in achieving the 95 goals. I have no doubt that Naca, in collaboration with other stakeholders and their unwavering support of the federal government of Nigeria, can successfully fulfill its mandate and ensure an HIV-free Nigeria in the shortest time possible.
In his remarks, the Secretary to the Government of the Federation, Boss Mustafa, commended Naca and partners for the achievements so far and called on state governments to play more active roles in the national response.
Notable milestones achieved by Naca under this administration include landmark HIV survey, which showed fewer Nigerians were living with HIV and the most likely geographical locations to find them. More than 1 million persons living with HIV were identified and placed on treatment within the last 6 years. And recently, His Excellency President Muhammadu Buhari launched the private sector-led HIV Trust Fund of Nigeria. Our achievements in the national HIV response underscore the fact that together we can achieve much more. I must emphasize the importance of partnerships, as well as the harmonization of programs for greater impact. It is in this regard that I call on state governments to take their rightful place in this national partnership as we develop a sustainability framework for the national response.
Nigeria has recorded several milestones in the last 15 years of Naca's existence, but more work needs to be done to ensure control of HIV and sustain all the achievements going forward.
Sister! Where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sentence. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with Naca, I am Ade Suwalsi. Goodbye.